Thank you everybody for joining. I hope you've had a good evening or a good day so far. So welcome to our Safe Staffing Program Childminders webinar. The session will be no longer than 1 hour. I appreciate everybody's had a long day, been working, but I hope you'll find the session very informative. We will be recording the webinar, so please keep your cameras and microphones off just to help with interference. A copy of the webinar and the presentation slides will be shared on the hub page once our communication team has prepared the recording for sharing. During the session tonight, we'll be sharing some polls and evaluations throughout the session. Some of these will be via a link or a QR code, and others will be embedded in the chat function of Microsoft Teams. You can also use the chat function to make comments and ask any questions. I have colleagues working in the background who I'll introduce in a moment, who will respond to the chats and or pass any questions on to me to answer at the end. If you would like any direct support, please use the Safe Staffing email, which we'll share at the end, and we'll respond to your request. So to start overview of the work of the Safe Staffing Program, I'd like to introduce you to our team. So our oversight is from our Chief Nurse, Marie McCary, and then our Program Lead, Stephanie Tom, is on the call as well. We have our Improvement Support Officer, who's Ashley Smith, and we have 3 Safe Staffing Advisors, which is Chloe McLaughlin, Melissa Cook, and myself, Candice Aitken. We would like to take this opportunity to hear from you. So please take a moment to complete our short poll, which is about the implementation of the Act. My colleagues will pop a link in the chat, or you can use the QR code. I'll give you just a few moments to do so. The information we gather from these webinars are invaluable to our evaluation of the program. Thank you. I really appreciate that. There's a few questions there. So the session overview for this evening, I'll do a brief overview of the Health and Care Staff in Scotland Act 2019. I'll be then looking at the resources available for the implementation of the Act. There'll be a bit about inspection and self-evaluation and evidence you can use to support your implementation of the Act. And finally, at the end, we'll go over the questions and evaluations from yourselves. So before I get into the slides, I'd like to take this time to share with you some information about the program. Last year saw the Safe Staffing Program focus on sharing information on the Health and Care Staff in Scotland Act across all services and organisations. We held close to 500 different events in a range of ways, whether online and in person, and over 7,500 people attended these. Now, our end-of-year report is available for more information if you would like to learn about the work that we carried out in 23-24. Now we feel it's important to look forward to the year ahead, both for our Safe Staffing Program as well for services. On the screen, you'll see the objectives for the Safe Staffing Program for the next year. And that is to ensure governance around the reporting are in place and to ensure the work plan is effective and complies with legislation and regulatory requirements. We'll continue to work with stakeholder engagements using media platforms and resources to embed the Act into everyday practice. We'll review and update existing supporting guidance and agree a range of core resources that will continue to support stakeholders beyond enactment. And then we'll explore how the compliance with the Act can be reported, including exploring changes to the Care Inspectorate's rights functions, reporting and data collection processes. So we know that the foundation of improving children's outcomes and providing quality care is based on the quality of people providing the care for these children. The training and values of individuals underpin the quality experiences and opportunities that children receive each and every day. So the Health and Care Staff in Scotland Act 2019 has a focus on valuing and appreciating all the individuals providing care. This evening, I'll provide a brief overview of this legislation. Now, if you need a more in-depth presentation, please visit our hub page where we have shared all the webinar series from last year. So to recap before I move on, there are 4 parts to the Act. Part 1 is of the guiding principles, and Part 3, which is staffing and care services, are the most relevant to yourselves in social care. Part 3 are for services using a staffing method framework, which at the moment is just care homes for adults. Part 2, you don't need to worry about, that is staffing in the NHS. And then Part 4 is where you'll find the general provisions, where we're given powers to the Scottish ministers about the enactment. Now, all care services have a duty to follow Part 1, the guiding principles of the Act, and Part 3. Now, this includes Section 7, appropriate staffing, Section 8, training and qualifications, and Section 10, subsections 1 and 2, which is having regard to any guidance issued by the Scottish Government. Now, I'm going to cover these as part of this evening's presentations. So I'm sure you've seen this slide if you've attended any of our other presentations. It's Part 1, which provides the main purposes of the Act and the 8 guiding principles. Part 1 are the overall principles that states that the main purposes of staffing for health and care is to provide safe and high quality service and ensure the best outcomes for people who use those services, the children in your care. So when we're considering this legislation and the wording of the Act, when it refers to staff, this includes all individuals who work in services providing care for children, which in many cases is yourself as childminders. So when it states the main purposes of staffing, it's referring to the main purposes of the service you provide. Of course, when you employ assistants, this would also refer to ensuring that the people you employ in your service are employed in order to meet the main purposes of their role. You should be considering how these guiding principles are used to develop and deliver your service, and when appropriate, making decisions about staffing and when you employ an assistant. Regardless if your assistant is a family member, under the requirements of this legislation, they are considered staff. Now, in order to achieve the 2 guiding principles of the Act, it provides 8 principles that you should look at holistically to achieve this. So Part 1B is where you'll find the 8 guiding principles. These 8 main principles are on the slide, and they are featured in Part 1B. The main principles of the Act must be considered when delivering your service, in order for you to achieve the main purposes of what are set out in the last slide. Now, we know and appreciate the care sector already work towards these principles, and we wanted to highlight this to you in order to relieve any anxiety and also to empower you to think of ways in which you already do this in your practice. If you attended my presentation last year or watched any of the webinars for childminders, you know that we wanted to support childminders and demonstrate this legislation in ways that you can see yourself and your service in. We are aware of the uniqueness of childminders and the valuable offering you do bring to children's care, their play and their learning experiences. So we adapted the wording from the main principles here to show you how this may affect your service if you're working as a sole child provider and if you have an assistant. So this is how the adapted wording for each principle. We'd like to show you on the slide. Now, I don't want to go through all of the principles because this is just a brief overview. If you wanted more further details, please do watch our previous webinar. So we were requested to hear more voices from the sector last year of how services were meeting the expectations of the guiding principles. So we collected all this information from a variety of events last year and we combined them in word clouds. Again, they can be found on the Hub page. So what is meant by care services, and especially care services that applies to and that is defined by the Health and Care Staff in Scotland Act, are services mentioned in the Public Service Reform Act 2010. You can see here the full list of services that includes ELC, adults, and CYP. But I wanted to bring the letter K showing you that childminders were included in this. So the Act defines workers in a care service in Section 11. This includes working for payment or as a volunteer, working under a contract of a service or apprenticeship. A contract or service for otherwise For example, employees of a care service, agency or temporary workers, self-employed workers, which is yourself as childminders, any apprentices or pay-as-you-learn schemes, or any volunteers. So this, I'll reiterate, even if it's a family member supporting you as an assistant or on a volunteer basis, they're still considered staff under this legislation. So please consider this definition if you ever have anyone supporting your service. So I won't go through all 8 guiding principles this evening, but I wanted to highlight 2 of them for this to you. On this slide, you can see how we have linked some of the health and social care standards and areas of the quality framework, which are currently regulated against at the moment. So if you have processes and procedures in place that are linked to these standards, you may find that you already have systems in place that support you to look after your own well-being. When we talk about your own well-being, it's insofar that it affects the guiding principles of the Act, and that was to provide that safe and high-quality service and ensure the best outcomes for children. So I hope this demonstrates that this legislation is not seeking anything new or innovative models of delivering your service, and that you may already be having measures in place that would support you to meet the requirements of this Act. So the big change with this legislation was well-being of staff. So let's consider what happens when staff well-being is not being taken care of. You may be more prone to stress, fatigue, and burnout. If you're unwell, you may struggle to concentrate or work effectively, and thus reducing the quality of your work. Poor staff well-being can increase absence rates due to physical and mental issues. For example, if you have an assistant. Importantly, any of this may have a negative consequence on the care outcomes for children in your care. Now, on a more positive note, improvements in staff well-being will lead to increased productivity, increased performance, improved satisfaction, and increase in morale, making you more likely to turn up, engaged, and work more effectively. So please remember, enthusiasm spreads. So the second guiding principle I wanted to bring your attention to was the number 7. And this is an example of the word cloud I mentioned earlier. So the guiding principle 7 is talking about allocating staff effectively and efficiently, with the wording created for childminders on the slide. So recognizing what you can accomplish as a sole practitioner and managing your time or your assistance if applicable. Now, staff deployment has the greatest impact on providing high quality standards, and that can bring about the best outcomes for children. So you need to consider, are you able to pick up from 2 schools, for example, without affecting the quality of care and experiences for children? So this is all about what you can manage on a day-to-day basis while considering your own well-being and the outcomes for children. This cannot be prescriptive because this will be changing depending on your skill mix and the needs of the children at that time. Now, part 3 of the Act starts in section 7. It is the duty on care service providers to ensure appropriate staffing. Again, we are referring to people who provide care for children. So this would be for you to determine how many children you can provide care for as a sole worker or an assistant if you have one. So this means providers must ensure that they're suitably qualified and competent people working in your service in numbers that are appropriate for the health and well-being of the children. And I'll keep referring back to ensuring that safe and high quality care. So it's in most cases ensuring that you're providing care for the right number of children depending on their individual needs. So the minimum ratios provided by the care inspectorate will not be changing at the time for any ELC service, including childminders. However, there's still that responsibility on you to determine what constitutes appropriate childcare provision by considering the nature of your service, the number of children experiencing care, and the needs of those individual children. You are the experts in this. You know what, if you're undertaking well-being checks, if you are looking after the children's well-being, and if you're meeting their outcomes. So section 8 within part 3 is about staff training. The Act states that providers must ensure staff training in the services and to receive appropriate training for the work you are to undertake, and any suitable assistance for your assistants in obtaining further qualifications if appropriate to their work. Now, this doesn't just mean formal qualifications. This should consider the skills, knowledge you need to provide that high quality care based on your best practice, including any assistance you may employ. This is about ensuring staff are suitably trained and services employ people with appropriate skills, competencies, and values. This is for childminders working independently and how you would refer to yourself as the provider for your care. You can consider how you identify your training needs. Do you find time to consider any of the reading or training you've undertaken? And how this could have a positive impact on the children you provide care for. And do you have opportunities to share your reading or learning with colleagues, such as other childminders or childcare professionals, to engage with? These are good questions to ask yourself and for informing your practice and ultimately influencing continuous improvement. So now let's have a look at what support and resources there are to support you in implementation. A learning and education resource has been developed as part of a collaboration between the ACT implementation team in Scottish Government, NHS Education Scotland, HIS, and the Care Inspectorate. Now, this is an accessible resource that enables you to learn about the guiding principles and the different duties that I've spoken about. Now, you can navigate through this resource, and they are sorted by sector, and find different websites and links to support your learning. The information and the detail within this resource will continue to be enhanced and updated to reflect emerging needs in the services, including specific resources for colleagues working in social care. So this resource is made available using Sway technology, and someone in my team will put a link into the chat for you now, just for ease of access. So I just want to play this little video, and this is how you can access the Safe Staffing Program hub page. Again, someone from my team will put a link into it. If you go onto the hub page, you will see there are sections for adults, children and young people, and ELC services. If you click onto the irrelevant section, for you it will be ELC services, you'll come onto our main page where you'll see a poster that we created. This poster is downloadable, and you can then print it to put up in your service or share with families and your assistants, and it just talks about the relevance of the Act. Scrolling down, you'll see we've created different sections for daycare of children, childminders, and then other relevant resources. Within each section, I'm just demonstrating the daycare of children here. You'll see the bite-sized videos we created. We've also linked each of the 8 guiding principles into hyperlinks where you can click on to each one, and it'll open up to the statutory guidance that links to that guiding principle. Please note this is just for reference if you wanted to look further into the Act. We have also added documents you may consider that is relevant to that guiding principle. Here is an example for improving children's outcomes with a statutory guidance and a whole host of documentations that are still already available for the sector. Further down, we have a second bite-sized video that goes into part 3 and the relevant statutory guidance. Like I said, that was daycare of children, but there is a childminding section, so please go through and have a look at that, where we've also put in last year's webinars with the presentation slides that went along the webinar. So we have lots of resources on the hub to support you and your service in meeting the requirements of the Act. So this is just a little recap page where you can see the poster that you can download. We also were giving out physical short guide cards that were given out in our regional events last year to all participants. We have now developed that into an interactive Sway, which you can also access from the hub. If you would like the physical cards, please email us with the email address at the end, and we can send those out to you. There is a question and answers resource, as well as frequently asked questions section, information guides, and then each section has been produced with the recordings all of last year, as well as this one will be put up as well. Now, we're going to take a short pause to complete 2 short surveys. We hope that you are confident accessing the Safe Staffing Hub page. So we're very keen to hear about what type of format of resources works well for you. My colleague is going to put the poll up in the chat. This is anonymous, so please take some time to tell us what works well for you. Like I said, we are constantly developing new resources. It's part of our objectives this year, and it really helps us improve the resources available for the services. And once you've done that, the second poll is, if you have any information or resources that you would feel useful, please add that suggestion in the second poll. I'll just give you a moment to do that now. I don't want to rush everyone, so I'll just give you another few seconds and then I'll move on to the next slide. Thank you very much. We really do appreciate that. So here's some of the work we're carrying out in this year. So the Safe Staffing program has put together an implementation subgroup. We're going to meet every quarter, and this is where the services can really share on what is working well within the sector with regards to implementation of the Act. We're working on developing a podcast where we'll be speaking to people internally and externally about what this Act means in real terms to services and how you can get support to improve the provision and requirements of the service. We're working with the SSSC in developing resources. I mentioned the staffing method framework early as part of Chapter 3A, which is only relevant to care homes for adults. But now there is a caveat in the legislation that says ministers may ask that to be developed into other services at some stage, but at the moment, you don't need to worry about that. And then we're also working behind the scenes to data mine information about what this is meaning for services with regards to inspection. So in summary, the part of the Act is Section 7 and Section 8 that is enforceable, and that care services must have regard to Part 1 of the guiding principles, which I covered above. I'm now going to move into some improvement information. We felt it would be useful to have a few slides about inspection and self-evaluation. So here you can see the key questions for this year's inspections. With regards to evidence, the ask of the Act does not require any additional information for services. So that again is to alleviate any pressure. We assess the core assurances at every inspection, except follow-up inspections. So during inspection, if we have any concerns arising from the assessment or a particular core assurance, we might consider evaluating other additional information and quality indicators from above. We use a proportionate approach to carry out these core assurance activities and use sampling to decide if any further scrutiny is needed. So to cover the core assurances scrutiny, your registration certificate, insurance, as you can see, well-being, which reflects very well for the Act, your protection, infection, medication, your leadership, your accidents and incident reports, improvement plans, complaints and management, and then your staffing, your recruitment staffing and safe staffing, which is directly related to this Act, your setting and your planned care. So self-evaluation is not something services should be doing solely for the benefit of the Care Inspectorate. It is a tool to help services identify and evaluate where they need to target their efforts to support improvement. Now, the ELC improvement team within the Care Inspectorate have produced an introductory to quality improvement bite-sized sessions, which you can find on the ELC Improvement Hub, and one of my colleagues will put a link into the page just for ease of reference for you. Now, there are 4 bite-sized videos in this series, which aim to introduce and support you to applying quality improvement approaches within your own service. These sessions are designed to be viewed consecutively with short activities to support you in making sustained improvements within your service. Really worthwhile looking at these bite-sized videos if you haven't done already. And even if you have self-evaluation processes in place, it might be worth revisiting just to sharpen up to see where you can make improvements. This all goes towards your learning that we spoke about in section 8. So in the context of care, self-evaluation is a continuous process aiming to deliver gradual improvements, prioritizing areas that have bigger impact on outcome for children using your service, or where there's risk of harm associated underperformance. So again, I'm going to say, irrespective of our role as a national scrutiny body, care providers will want to satisfy themselves and their stakeholders in providing that high quality service, and self-evaluation is part of that. We believe that the quality framework is a helpful way to support care services to assess their performance against expectations of outcomes for children out with that inspection process. So more information about self-evaluation can be found on these sites, and my colleagues will put the links in the chat for you now. So that was a brief overview of the Act, information about self-evaluation, and now I'm going to open up to any questions and comments. Just going to move back into that. While I'm waiting to see if everybody wants to come on, you can see our Safe Staffing mailbox email address there, also a link to our hub page. And if you've not already, please do join our mailing list, which you can find a link on our hub page again. And this is where we send out general information about new resources that have been developed, up and coming events. So it is important or useful to be part of our mailing list.